Thanks, Chair, and good morning, conference. Well, what did I say? How am I supposed to follow Ken Loach? Well done, Ken. That was a fantastic speech. Save South Tyneside Hospital campaign was set up in May 2016 on the initiative of the South Tyneside Public Service Alliance of trade unions and people in the community. When the downgrading of South Tyneside Hospital was announced as part of the alliance between South Tyneside NHS Foundation Trust and City Hospital Sunderland. The reliance of City Hospital Sunderland, announced in April 2016, became a takeover in August when the Sunderland Chief Executive Officer and executives took over the running of South Tyneside District Hospital, even though it is a separate trust. Before any consultation started, they had already declared that it was no longer safe or sustainable for either organisation to duplicate the provision of services. Then this immediately became a so-called path to excellence, to close and downgrade all acute services at South Tyneside District Hospital. And then the shadowy NHS Improvement and NHS England were behind opposing top-down, predetermined clinical reviews without the involvement of clinical staff, including most consultants of both hospitals. This was then incorporated into the Northumbria, Tyne Wear and North Durham STP, which the campaign successfully fought and exposed, and to this day is still only a draft that no one is admitted to signing off. Yet we hear now the 3 STPs in the northern region are about to merge. Yet, as you know, following the general election in June, the government did carry on without any agreed STPs, and South Tyneside Clinical Commissioning Group announced in July this year the first phase of the downgrading of our hospital, proposing options that will see the loss of consultant-led maternity services in the special care baby unit, which is the best performing in the country. It will see the loss of the 24-hour consultant-led children's A&E, which again is also one of the best performing in the country, and the loss of all hospital stroke services to Sunderland. As you know, the downgrading of South Tyneside Hospital and other hospitals is fundamentally a result of the whole direction in which the government is taking the NHS. It is deliberately reducing NHS funding both for frontline health services and clinical staff. This process is wrecking the NHS by fragmenting it into purchasers and providers, closing acute hospitals in A&E departments. It is facilitating the takeover of most of the profitable services by private health companies. This continued direction is reflected in the reliance between South Tyneside Foundation Trust and City Hospital Sunderland, with the aim of closing acute services at South Tyneside Hospital. The campaign is not only against the downgrading of acute and emergency services in South Tyneside, but is also to stop the further impact on already overstretched and underfunded services at City Hospital Sunderland. When it was founded, the campaign elected its chair, a retired trade union organiser, and elected a coordinator, a Unison area organiser, both who have extensive experience in fighting to unite the trade union and working class movement and community for their aims and interests around the modern agenda that healthcare is a right for all. For us, this placed the organised working class movement at the centre of the campaign, enabling both staff, trade unions and the active in the community, young and old, to work together to save the hospital and its services. Since the formation of Save South Tyneside Hospital campaign, this work has brought people together from trade unions in the hospital, people in the community, MPs, councillors and political parties into a campaign where the people decide, working out their aims and actions regardless of their political views. The campaign has a great working relationship with the Hospital Unison branch that fights to organise in the workplace, protecting and representing staff's views and submitting the staff's alternative proposals to the downgrading of acute and emergency services in South Tyneside. Also, hundreds have been involved in the consultation and activities of the campaign. We also have great relations with other trade unions such as Unite, RCM, consultants and so on. Central to the work has been the activity of both South Tyneside MPs in raising the concern of Save South Tyneside Hospital campaign in Parliament, and indirectly representing the concerns of clinicians and other staff in giving their full support to the campaign. Those who lead Save South Tyneside Hospital campaign lead on the basis of the working to keep their initiative in the hands of the local community. Trade unions involved and clinical staff, those who were fighting to save the hospital. We oppose any attempt to divide the campaign on party political and sectarian lines, but instead focus on the aim of the movement to safeguard the future of society in a modern healthcare system that meets its needs. The whole aim has to do the release their initiative, the people to take action in defence of their hospital acute services and safeguard the future of the NHS. And as you will see from the film that hopefully might be played at some point today, the campaign has inspired so many young people, including the mums, children and staff, to fight for the children's A&E and maternity services. And so just briefly, to sum up the campaign, again, obviously, you know, we all work together, obviously, to draw up actions. Again, we work very closely with councillors, with scrutiny committees both in South Tyneside and Sunderland. We hold regular stalls and petitions, leaflets, 3 mass meetings with a panel of local speakers involved in the campaign, as well as experts outside of the campaign. We've had 2 very successful marches and rallies, and our petition has now reached well over 30,000. This shows the work that has been done in South Tyneside, which has moved on to really good work in Sunderland. Again, just to finish off, how to release their initiative of all the people and make the movement unstoppable in achieving its aims is very much the problem. We are all grappling with how such discussions as today can assist the movement, if only in presenting the right questions and posing the problems that need to be solved. Our movement is tapping into new forces such as clinicians and people at all levels of society, expanding the influence of the alternative programme of the working class movement right across society. That will ultimately determine the outcome of the aims of our movement. We are building that movement which has
I'm sorry,
been the potential
Gemma, I am going to have to stop you.
Yeah, so best in our hospital. So again, we are building that movement which has the potential today to shape a new future for society that reflects that is best for our hospitals, our NHS and our workplaces, based on our outlook for a modern society where healthcare is a right and the right is guaranteed.